Health matters now. Today is World Malaria Day, and some experts are using this year's theme to accelerate the fight against the ailment for a more equitable world in order to push the need to urgently address the glaring inequities that persist in access to malaria prevention, detection and treatment services, especially for pregnant women. The right to quality, timely and affordable services to prevent, detect and treat malaria is still not a reality for many people. Pregnant women and children under the age of 5 usually have reduced immunity to malaria, making them more susceptible to the infection and increasing their risk of severe disease and death. With this, a non-profit organization has intervened to give out intermittent preventive therapy to more than 1 million pregnant women across 3 states.
And, implementation in the country. We are aware that government is doing a lot in partnering with donors, including the World Bank, Islamic Bank, through the National Malaria Elimination Office, to accelerate the process of reducing the impact of malaria, on the people and by extension on the economy. But government also will need to do more to sustain the momentum, to see that indeed we are able to reduce the economic cost of malaria diseases in the country.
I'm joined by the National Coordinator, CEO, Civil Society in Malaria Control, Immunization and Nutrition, Ayo Ekpumoyi. Good to have you join us.
Good afternoon. Thank you for having me.
Good afternoon. Let me start by asking you the groups, to talk to us about the groups that are most at risk and why is it so difficult for them to access treatment?
Thank you for having me, and thanks so much for the hard work with us on the World Malaria Day this year. The groups most at risk are children under 5, pregnant women, and more than that, it's the poor and the most vulnerable of the population that actually suffer most. And that is why this year we are talking of reducing the inequities, because malaria is both a cause of and a product of poverty. So when we say children under 5 and pregnant women, it does not cut equally across the quadrants of wealth and poverty. Those who are on the lower quadrants actually suffer more of the effects of malaria than those who have high levels of disposable income. So it's a disease that makes the vulnerable even more vulnerable. That's why we need to promote equity.
And for some people who are listening right now, I'm sure they are wondering, what are the inequities? I mean, people just walk into a pharmacy and buy malaria drugs. So why should that be? Why should there be inequities, in that regard? Explain to us why these inequities exist. And I know you've talked about poverty and what can be done to ensure that that gap is bridged.
Okay, thank you. The inequities relate primarily to income levels and accessibility to disposable income. But in addition to that, it's also accessibility to services, healthcare services of good enough quality to prevent and to treat malaria. Now, like you said, most Nigerians just walk into a pharmacy to buy and take malaria medicine, and often without testing to be sure that what they have is malaria. And when people resort to self-treatment, in many cases, the treatment they receive